Are you considering staying in the workforce past your retirement age at 65? This is not uncommon these days, so in this video, I'll discuss how you should go about enrolling in Medicare when you plan to work past age 65. A recent survey found that 19% of Americans 65 and older were continuing full-time employment. If you work past age 65 for an employer with 20 plus employees, also called a large employer, you can delay certain parts of Medicare without penalty until you retire. Unless you are contributing to a health savings account, most people who are actively working for a large employer will enroll in just Part A at age 65. This is because Part A is premium free for most Medicare beneficiaries. You have already paid FICA taxes during your working years, and those taxes have sort of prepaid for your Part A hospital benefits. Enrolling in Part A at 65, therefore, doesn't cost you anything, and it can also coordinate with your employer coverage to potentially lower your out-of-pocket spending in the event of a hospital stay. Parts B and D, however, have monthly premiums you will have to pay. So most beneficiaries who work past age 65 for a large employer will delay Parts B and D to avoid paying those premiums. Later on, when you prepare to retire, you will need to use a special enrollment period to sign up for Parts B and D. Let's talk about how the special enrollment period works so that you don't make any errors that result in you paying an unnecessary late penalty or having a gap in coverage. When you finally retire, you will have an 8-month special enrollment period for original Medicare Parts A and or B. This starts the month after your employment or your creditable employer medical coverage ends, whichever happens first. For example, if you lose creditable coverage on March 31st, you have until November 30th to enroll in Part A and B to avoid late penalties. However, most people don't start their Medicare application process that late. They start before they retire because they want their Medicare coverage to start the day after their employer coverage ends. No one wants an 8-month gap in their health coverage. Your special enrollment period is the same even if you have COBRA or retiree coverage. COBRA and retiree coverage are not creditable for original Medicare because both those types of coverage pay secondary to Medicare. Medicare itself is primary. So even if you qualify for 18 months of COBRA or lifelong retiree coverage, you need to enroll in Medicare during your special enrollment period or you may incur late penalties. Now that we've discussed when you should enroll, let's talk about how you should enroll. If you don't already have Part A, you can go to the Social Security website's page and apply for Part A. However, for Part B, there are some necessary forms that you and your employer must complete that will need to be submitted to Medicare. The first form is called CMS 40B, and it is your formal application for Part B. You can mail or take these forms in person down to your local Social Security office, but the most efficient way is to upload them directly into your portal on the SSA.gov website. Now, on Form 40B, you can write in the effective date that you want for your Medicare in the remarks section so that they know when you hope to start it. The second form is Form CMS L564, which is a request for employment information that your employer will complete, attesting to your dates of creditable coverage so that you don't pay a late penalty for not signing up for Medicare at 65. Now, if for some reason your employer cannot complete their portion of the second form, you will need to provide at least one other acceptable form of proof of health coverage. In that case, the beneficiary can complete Section A and leave Section B, the employer portion, blank, and then include at least one other acceptable proof of group health coverage. Some acceptable forms of proof may include, but are not limited to, a certificate of creditable coverage from your former group coverage, a copy of your health insurance card with the effective dates, income tax returns that show health insurance premiums you paid, or even pay stubs that reflect health insurance premium deductions. You essentially just need to prove to Social Security that you don't owe any late penalties for delaying Part B because you maintained other creditable group coverage. However, I want to warn you that it can take Social Security several weeks to process these applications, so be prepared to start this process early. Medicare premiums change annually, so you can expect your costs to look different a few years down the road. For example, if you evaluate your options at 65, your premiums won't be the same if you apply at 68 when you retire. Medicare premiums naturally will increase due to inflation and the rising cost of healthcare. However, you don't want this to scare you into applying for Medicare at 65 if you have credible coverage that satisfies your needs. Employer insurance can often be more cost-effective, especially if your spouse is covered by your insurance. This is why working with a Medicare broker like us is beneficial, as we can help you compare costs and determine the most cost-effective coverage for you. Some people pay more than the standard base premium for Part B because they have higher incomes. Social Security will likely assess an income-related monthly adjustment amount, or IRMA, on top of your Part B monthly premium. However, since you're retiring and may no longer have that higher income, you can appeal your higher Part B premium by completing and submitting Form SSA 44, which is Medicare's life-changing event form. You use this form to notify Social Security that your income has changed due to a life-changing event, which in this case is retirement or what they call work stoppage. Now, we also have a YouTube video and a blog dedicated to this topic, so we'll link to it and all these forms I've mentioned in the description below. While you have 8 months to sign up for Medicare Part B after you leave employer coverage, the special enrollment period for Medicare Part D is much shorter. Your special enrollment period for Part D starts the day you lose credible coverage and lasts for a total of just 2 months. Now, if your employer offers retiree coverage or COBRA, which usually includes coverage for prescription drugs, you may be able to delay Part D until you lose that coverage. Check with your employer's HR department to see if your retiree drug coverage is credible to Part D. Lastly, Part D plans are not sold through Medicare. Instead, you'll enroll with a private insurance carrier that offers a Part D plan in your state. Once you have Part A and Part B, you can enroll in a Medigap or Medicare Advantage plan. If you plan to go with a Medigap plan, be aware that you will have 6 months from your Part B effective date to enroll in any Medigap plan without having to answer health questions in most states. For example, if your last day of employer coverage is March 31st and you apply for Part B during March, your Part B will likely start on April 1st. April 1st will be the first day of your Medigap open enrollment window, which will close on September 30th. After that point, you can still apply for Medigap, but you must answer health questions in most states, and an underwriter will review your application. Your acceptance is not guaranteed. If you choose to enroll in a Medicare Advantage plan instead of a Medigap plan, you will have 2 months from the last date of employer coverage to do so. If you miss the special enrollment period, you will have to wait until the next annual election period, which starts in October each year. I have a team of agents who would love to help walk you through your timeline, and we would be happy to discuss your Medicare options. I have linked our What Medicare Covers playlist next, so be sure to check that out to learn more about Medicare coverage and how it compares to your current coverage.